watching a Hit TV, empowering you. You're watching a Hit TV, empowering you.
Good evening, our viewers from...
You're watching a Hit TV, empowering you.
Good evening, our viewers from Yit TV. This is the health program of Yit TV, and today we are going to discuss very pertinent issues that concern the use of drugs. I'm called Dr. Peter Nwajira. I am a pharmacist working in community pharmacies, because pharmacy here in Barara, and Pharmalift pharmacies that are spread all over the country. I'm also a lecturer at Barara University of Science and Technology and a researcher in the same university. Today we are privileged to talk about drug expiries. We are going to share from a patient's angle, from a policymaker's angle, from a researcher's angle, and even a practitioner's angle as a healthcare professional. What drug expiries, what do they entail? How do we manage them? Okay? How do you manage them as a patient? How do you manage them as a healthcare professional? How do you manage them as a policymaker, as a researcher? And I'm happy that we are talking about drug expiries at a time when the newspapers are awash with so many headlines about drugs going into wastage through expiry. Just a few, maybe last year, there was a headline in the newspaper here in Uganda where about 550,000 US dollars worth of antiretrovirals, the drugs that are used for managing HIV, AIDS, they got expired to the worth of 550,000 US dollars. In just 1 year, in a low and middle income country like Uganda. We also know that about 10 million of antimalarials expire annually in our country. That's too much wastage, especially in a country in Africa, sub-Saharan Africa, where access to medicines is still a big problem because of affordability. Most of our population cannot afford to buy drugs from their pockets, and there is not much health insurance coverage for most of our population. So already we cannot access drugs in a very, by most of our population. They are not able to access drugs. But those that can actually access drugs, you find that those drugs are going to get expired. So it's a big problem for our country, it's a big problem for the healthcare providers, and for the patients who are actually at the end tail of this problem. So drug expiries is a very big, very, very big problem. That is what I want to mention to us. It makes it very expensive for the country, to procure drugs and have them wasted, that the patients cannot use them. On the part of the healthcare professional, when drugs expire, it means you have to look for space to store them, at least before they are disposed of. and that is a lot of money needed. For the policymakers, it means some policies cannot be well actualized, implemented, when we don't have enough drugs, because a big percentage of the drugs expire. It's a very important message to all of us. So what are drug expiries? When we say the drug has expired, what does it actually mean? It means that at that date, what we call the expiry date, at that date, the manufacturer, okay, is able to guarantee the full potency and the effectiveness, the full potency, safety, and effectiveness of the drug, okay? So it means that he is assuring the patient that by this date, he is sure that his drug that he manufactured is able, if it is an antimalarial, it has the right amount of drug in it to kill the malaria parasites. Or if it's an anti-infective, antibacterial, antibiotics, for example, it has the right amount of the drug to kill the microorganism. So that is his guarantee that his drug still works. So it means that expiry dates are actually set by manufacturers, who are the primary researchers and innovators of these drugs. It's also a means. Expiry date means it's a means that one has to use these drugs within that time frame. Okay? You should be able, it helps the supply chain, the pharmaceutical supply chain, from importation to storage to distribution to use. It means the drug must be used, distributed, imported, within that time frame, so that we do not use expired drugs. We do not import them, we do not store them, we do not distribute them, we do not use them. Okay? So expiry date is a very important marker or parameter in maintaining drug use levels for our population. Okay? So then the question, how do drugs expire? Because we want to see how do they expire, why do they expire? Okay? How do drugs expire? If you bought amoxicillin, for example, powder, okay, for the children, it could be Clavulin, it could be amoxiclav, augmentin. If you bought it and you found the expiry is maybe 2 weeks from the time you have bought it, how will it come to expire? So usually, every drug that is manufactured, it is given a range of stability, okay, or a time frame in which it should be stable for use. It means that the amount of the drug that the manufacturer put in that drug will work and will not get degraded. It will not reduce its concentration. It will not cause toxicities, okay? It may cause normal side effects that we know that all drugs have, but not toxic, that it cannot be used. So that is how drugs expire. That is just an example, okay? But also drugs can expire because you have used them, you have opened the containers. Talk about eye drops, talk about even those powders for reconstitution like amoxicillin. I told you, when you open it and dilute it, it means you're opening it up for degradation. It could be by microorganisms, okay? It also means that you have opened it up for other contaminants to come in, and that will reduce the amount of the drug, okay, available for use, but it also will bring in contaminants which can actually cause toxicities to the patient. So And depending on the dosage form, we know that solid dosage forms, for example, tablets, capsules, they will have a longer shelf life, or what we call a longer expiry period, okay, than, for example, those powders that need to be reconstituted or the liquid preparation. Because when you open paracetamol suspension, then you cannot use it for a year, for example. It's not possible because I know it is a repeat dose formulation, but again, you cannot, the moment you open it, then you're reducing its chances to reach its expiry time. So the pharmacist that you find at the pharmacy should be able to tell you, after opening that container, for how long it can take, okay? So that is how drugs expire. And like I said, drug expiries occur also to our advantage, because if drugs like any other consumables have to have expiry date, because if they don't, it means they would be immortal. Our grandfathers, the drugs that they used, would still be using them, but we know that they are perishable. So the other way of how drugs expire is actually by the way we store them. Okay, if they are supposed to be stored away from heat, away from direct sunlight, and you put it there, the truth is that they will expire. They will get degraded. Okay, so the way we store our drugs, the dosage forms in which they are stored, okay, or formulated, all contribute, okay, to how drugs can expire. Okay? So drugs expire to protect us, so that we are able to use them before the expiry period. They also expire to show that they are mortal, they just like any other consumable. Okay, but it also helps the manufacturers to, get back money, to recycle, because if a drug expires in 2 years, it means, and it has a market, it has a demand, it means every 2 years I should be able to produce another batch. And so that helps also in the health economics, the economies of the manufacturers. So they are what we call short expiry drugs, which I've already discussed. Most of them are, for example, antibiotic powders for reconstitution, eye drops, nasal drops, all these that are in most of these liquid preparations. But they also get shortened further if you actually open them, if they are repeat dosage forms. So we want to see beyond just drug expiries. What are some of the factors that actually contribute, that bring about drugs to expire? Okay, that is the heart of this discussion. Because if we know the factors, if we know what contributes to drug expiry, then we are able to prevent it, we are able to manage it, and we are able to mitigate ourselves from the consequences. So what are some of the factors that would make drugs expire? There are quite a number. Every stage of the supply chain, of the pharmaceutical supply chain, if it goes wrong, can actually contribute to drug expiries. And what are these stages of the pharmaceutical supply chain? There are majorly 6. We talk about medicine selection, how medicines are selected. If before you procure, you have to select the medicines. You have to know what is the scope of the medicines I use at a certain health facility, whether it is health center 4, whether it's a district hospital, whether it's a national referral hospital, whether it's a community pharmacy or a drug shop. Before you procure, you must have a list. Okay, so at selection stage, if anything goes wrong, then you have a big problem. The other stage is quantification. Okay, quantification is where you come up with quantities. Okay, if I need quinine tablets, or if I need azithromycin tablets, how many do I actually need, okay? And of which strength? Do I need the 250 milligram or the 500 milligram? So getting into the details of the quantities and the strength and pack sizes, that is quantification. Then procurement, you're able to, what you have quantified vis-a-vis the budget that you have. For you to make an order, you have to have a budget for the drugs. So if you quantified things worth 200 million, but you have only 100 million, it means you have to cut some of the quantities to be able to work within the budget. And then you're able to do effective procurement. If anything wrong happens there, it can affect, you can end up procuring short expiry medicines that you will not use in that short time. Or even you may have those that have long expiry, but I mean you do not have demand for those drugs. So anything that happens at whatever stage of the pharmaceutical supply chain affects the expiry of medicines. The other stage is storage. Okay, is storage. Sometimes storage contributes to the expiry of medicines. Okay, if this store's person does not have as much knowledge, okay, on FIFO and FIFO, okay, first in, first out, and first expiry, okay, first out. So usually we use FIFO. We use first expiry, first out. If I got azithromycin 500 milligrams, but one is expiring in 4 months' time, another one is expiring in 1 year, I should be able to push or to prescribe that has a much shorter expiry, so that it does not expire in store. Okay, so at storage, anything can also go wrong, as we're going to see in some of the factors. At distribution, after you have picked drugs from the stores and you're taking them, to the different units, user units, okay, you may find that at that point, someone does not follow guidelines. Anything can go wrong at any of the stages in the pharmaceutical supply chain. The last stage, of course, is use. Okay, you can give a wrong drug to a patient, and he doesn't use it because maybe it was a wrong drug, and he does not give you feedback. So he leaves it there until it gets expired. He is denying that drug. He's denying other patients from using that drug because he's keeping it until expiry. So, what are some of these factors as we are going to see? I've told you that these factors they are distributed in the different stages of the supply chain. For example, when clinicians, non-participation of clinicians in quantification, clinicians ideally are the people that prescribe drugs. If they are not involved, in quantification, in deciding how much of these items are needed in a health facility, then they are going to prescribe drugs, and those drugs will be out of stock, and yet those that are in stock are not used. So the therapeutic and drugs committees of different hospitals, or the committees in the different pharmacies, okay, or the responsible people, are supposed to involve every stakeholder, okay, in the drug chain, every stakeholder, such that we do not have instances of drug expiries. The second factor that can contribute to expiry of medicines is incentive biased quantification. So many times we see marketeers come to prescribers, okay, give them incentives. It could be a shopping coupon, or a holiday, such that they are able to push certain medicines. Okay, when that happens, the prescriber is likely to bias himself only on those that have been incentivized, okay, their incentives have been given, and those that where there are no incentives, they are left in shelves and are not prescribed. So that's a very, very big problem, and it's unethical, of course, for our healthcare professionals to do that. But we know that the drug market has so many forces. So it is something that all users, policymakers, and the stakeholders must be aware about. Buyer incentives can actually bias and cause drug expiries to increase. The other one is shelf life not specified in some orders. Sometimes you make an order and on that invoice there is no expiry date. I know National Drug Authority, for example, here in Uganda, is doing its best to make sure that all invoices bear expiry date, batch numbers, manufacture dates. But there are some people who are not doing it. And when you don't do it, many dispensers will not know which one to push before the other. I talked about fast expiry, fast out. The first to expire, but when there are no expiry dates, then you have nothing to base yourself on to actually dispense this medicine. Then we also have profit margins that determine the size of purchases. We know that especially in community pharmacies or these private pharmacies in some of the hospitals, you find that because Epicephin, a brand of ceftriaxone, there is a good profit margin. So you stock it in big quantities, even when what is available in the market, okay, has short expiry. Okay, so you bring them and maybe you're not able to use them in that time period, and drugs expire because you have based yourself on profit margins instead of demand. Okay, the users, how much of these quantities they take. But because we want to push, because there is a good profit margin, sometimes we push and end up into having a lot of expired medicines in our shelves. Okay, medicines, yes, medicine supply by manufacturers. Okay, many times you find that medicines are dumped by the manufacturers. When a manufacturer says that this drug is likely to expire, he pushes it. He gives it maybe to government hospitals or government health facilities, or even private health facilities, even if it is as a donation. But remember, as long as they are donating to you drugs that whose demand is not available at your health facility, they may end up expiring. And yet, if you did good to know who will need these drugs, you could have maybe transferred them to units where they are best used so that they don't expire. Okay. We also have violation of standard treatment guidelines. Okay. Yes, you know that antimalarials, the first line treatment for antimalarials, but instead of stocking a certain, for the budget of antimalarials, you're supposed to store those on first line, of course, to store many of them, then those on second line, then on third line. You end up storing those that are on second line, okay? Just because maybe there's a profit margin, like we said, or by any other biases that the pharmacist could be having. And yet the prescriptions, okay, are covering first-line treatments. So you end up, because of that violation of standard treatment guidelines, okay, you end up causing expiries, okay? Then donations, like we said, that are received irrespective of need. It could be donations from private pharmacies to government hospitals to just create, a good business rapport so that they can get business maybe after some time. Or it could be manufacturers dumping, their drugs to the different hospitals. Okay? Or it could be, these NGOs. So dumping is a very big problem, and so is donations. As long as there is no need in that health facility, you should not receive donations. That is what the guideline says. Poor storage conditions, like we said, storage is very key when it comes to expiry. If you take drugs that are not supposed to be refrigerated and you put them in a fridge, truly speaking, you're going to have degradation, okay, faster, and those drugs are going to expire even before the expiry date. Okay, so storage condition is very, very important. When the pharmacist gives advice that store these tablets, okay, out of reach of children or out of light, okay, direct light, then you're able to, you should be able to do that. Otherwise, storage conditions become a factor that contributes to drug expiries. Okay. Yes, neglect of stock monitoring procedures. We're supposed to be monitoring our stock all the time, whether you're in government facilities or in private, facilities. The moment you abdicate that responsibility to any other people, okay, and yet you're the in charge on stock monitoring, then you create a big problem. The stores officers, for example, if you are supposed to update those stock cards and know and be updated with information, be up to date with information that these drugs are about to expire or they have a short expiry and the user department must use them before they expire. If you do not do that responsibility, you're causing the entire institution to have a big quantities of expired drugs. Okay? Poor management of a change in treatment policy. We've seen there was a time when malaria, okay, when we are changing from chloroquine, for example, as first line, to ACTs, to artemisinin combination therapy. For those that still had chloroquine for a long time, okay, of course it expired because the policy had changed. And that happens, by the way, in many countries, in many programs. TB treatment, it has, the policy changed, and so if you are keeping your isoniazid in high quantities, okay, definitely there is going to be expiry of more isoniazid instead of having more rifampicin than the isoniazid in the shelves. Okay, then we have irrational prescribing. Okay, irrational prescribing, it causes underuse of certain medicines. Okay, there are some people, like we talked about incentives or biases that by the prescribers of pushing one medicine against the others, even irrationally. But we also know that if you're not well trained in some of the medicines, you're not able to do a good linkage between diagnosis and treatment. So you end up doing irrational prescribing, and that is a big. Expired medicines are not isolated into their segregated areas. Many times in pharmacies, and I've seen this in community pharmacies, drugs expire, but because you have not separated them I segregated them to an area that you can keep records of, okay? And with time go on and of course dispose them off. If you have not separated them from the other stock, you're likely going to think that they are still usable, only for you to touch and you find, hey, this expired 2 months ago, okay? Maybe if you were aware about it early enough, or if you had segregated them as near expiry, medicines, you would have, improved you'd have prevented them from expiring. So there are many other factors that we know can contribute to drug expiries. Okay, so now that we know what can cause drug expiries, how do we manage them? Okay, how do we manage them? Now that we know the factors, we know how to prevent them. The moment you do due diligence during the pharmaceutical supply chain, the cycle, okay, from selection to quantification to procurement to storage to distribution to use, if you do your work very well as a healthcare professional, as a manager, as as a financier, as government, then we will prevent drug expiries. So when that happens, when errors happen, and there are drug expiries, to start with, you conduct a physical count. Whether you're in that store, whether you're in that user department, okay, that has been distributed those drugs, whether you're in a community pharmacy, in that drug shop, anywhere, including our homes, you're supposed to do a physical count, look at how many drugs have expired, okay? You can even use your system, okay? There are people who have good computerized system, especially private pharmacies, If you go to people's pharmacy, we are able to monitor our stock. We know which one is expiring in the next 6 months, in the next 1 year, because every medicine that we procure, we are able to track, okay? So it's important for you to do a physical count, okay? You can check in the system and still cross-check physically in the shelves. The next is when you have identified some of these expired drugs in the shelves through your physical count, please get a register and register them, okay? Get an expired drugs register and which must be updated, okay? Then you put them aside, you segregate them from the rest of the shelves, okay? After segregating them, of course, it should be under lock and key. It should be in a secure, very secure and excluded area, so that there is no temptation that people can actually touch expired drugs and dispense them to patients. When you do that, then do the adjustments, okay, in the stock card for those that have stock cards, or even in your computer system. The moment you remove the drugs from the shelf, you must make adjustments in the system, make adjustments on the stock card, so that we do not find the stock card with expired drugs, and yet they are not even there in the shelves. They have already been, and they are not even in the expired drugs register. Okay. Next, after you have segregated them, put them aside, inform the head of the facility. Okay. If it's a hospital, you have to inform the head of the Drugs and Therapeutic Committee, okay, or the pharmacist in charge. If it is a health facility, the in charge must be informed. Then he will inform the DHO, the district health officer. But if it's a community pharmacy, if it's a drug shop, okay, you have to inform NDA. National Drug Authority has what they call, these pre-qualified contractors, contracted to dispose of expired drugs. Okay, you contact the National Drug Authority if you're a private entity, and they will send you, that pre-qualified contractor who actually will come, weigh your medicines, okay, enter them in his register and take them for disposal. Okay, if it's a government hospital, the DHO who will call the disposal unit, okay, of the district, such that these drugs can actually be sorted. Okay, they are sorted into the different categories, because they are, for example, narcotics must be disposed of independently from others. Corrosives, these ignitables, or like alcohol, like these sanitizers, if they expire, they are supposed to be disposed of differently, of course, from the solid dosage forms, from the tablets. Okay, so they are sorted. The contractor will sort them, or the disposal unit of the of the district will sort them, okay? Put them in the different containers, and they will decide on the method of disposal. This could be incineration, okay? This could be incineration because we know that most of these, for example, sharp containers, or these other containers, or drugs that are in these hard containers should be incinerated, okay? They could also be diluted for liquid preparations. They could be just diluted, and then of course landfills, you're able to have a pit and power them there, okay? They can also be inertization, okay? They make them inert for those toxic medicines, okay, or those corrosives. There's you inert them, you change them into a form that they can no longer be toxic. So the contractor or the disposal unit will definitely go on and decide which method of disposal, okay? Heavy metals can also be harvested. They can be harvested. They can be made into a form that is recyclable, okay, or is reusable. So the different units will, the contractor or the disposal unit of the district will decide the method of disposal. So that is how we manage expired drugs. That is how we deal with expired drugs. So if you're a patient, if you're a patient or if you're a healthcare professional, you know how to deal with expired drugs. If you're a contractor, okay, you have been trained, of course, on how to dispose of these drugs, okay, and how to sort them. If you're a policy maker, you know that whatever policy, drug policy that we have in place, it definitely contributes to expiration of drugs, okay? So if the policy is good, it will prevent expiry. If it is bad, okay, if it is not well implemented, then drug expiries will increase. So generally, that is how we deal with expired drugs. And I hope that this is a pertinent issue for all of us, and that we are able to have something that we can do about this, okay? If you're a dispenser, you can know that you need stock monitoring routinely, okay? If you're the manager, you need to have a system in place that can be able to track drug expiries, okay? If you're a stores person, it means that you have to keep, those stock cards updated to be able to prevent drug expiries. So with that, I want to thank you for your attention. I want to thank you for your audience, and I look forward to helping us do more with our medicines, or how we can manage the different issues pertaining to healthcare and to drug use. Thank you, and God bless you.
You're watching AYIT TV, empowering you.